These are my nebulizers.
Megan DiBenedetto knows what it's like to gasp for air, to not have the lung capacity to even sit up.
Couldn't even get out of bed, which is not like me at all.
She's not a COVID-19 survivor. Instead, she's a cystic fibrosis warrior, battling a disease that only gets worse over time, even before she could stand in her own crib.
I was 9 months old when my mom found out.
News that changed her family's life. Their baby would always have persistent lung infections that would limit her ability to breathe. Meg's condition would flare up 27 years later, just as the coronavirus was brewing.
I dropped 20 pounds. My doctor was like, all right, we're just going to do a diabetes test. We're just going to see what's going on because you have no explanation of all this weight loss.
People with diabetes and cystic fibrosis are considered to be at high risk to the coronavirus. They've been advised to cocoon, to literally not leave their homes. But Meg isn't cocooning. She's flourishing in perhaps the most dangerous place for her. She's a nurse at NYU Langone, a hospital at the epicenter of the pandemic.
It's on my floor. It's not like I'm excluded. My whole hospital has it.
When New York had its first case, she thought about taking a leave of absence, and no one would blame her, but she hasn't. After years of her own suffering and nurses coming to her aid in surgeries and PICC lines, she's decided her spot is on the front line with her fellow nurses. She's trusting them to look out for her. So the nurses are really taking care of you and their patients.
They're doing everything they could, and it was very difficult. It's still kind of very difficult because I can't help them.
But she is helping them. Since Meg can't directly treat COVID patients, she's been doing everything else necessary to keep the hospital and her coworkers going, never letting a sickness get the best of her.
My parents kind of raised me that I was just like any other kid. The only thing is I had a really bad cough and I would get really out of breath.
They put their daughter in every sport, and Megan even went on to swim Division I. They still support her today, banging pots and pans at 7 o'clock each and every night. Just like in her own life, Megan has accepted the illness, and every day she fights to overcome it.
That's it. There's nowhere to run. You just have to deal with it.
This pandemic is no different. Sometimes, she says, you just have to run head on into your challenges. Since the crisis started, she's been taking long runs by her church, St. Bernadette, in Diker Heights, just to stop and say a prayer. Not for herself, but for everyone else.
It's not about me and my sickness, it's now about them.
And then she just keeps going. Michelle Powers, Currents News.
If you're watching Currents News on YouTube, be sure to hit the subscribe button and then click on the bell to get instant updates about all of our newest content, because we are putting your faith in the news.